Turn.
Okay. All right, Ashley, I'm going to do a head-to-toe assessment on you. Tell me if you're having any pain today. Nope. Nope. Anything bothering you? Had a cold, flu, anything? Nothing's hurting. No abdominal pain. Changes in your bowel and bladder status. Nope. Nope. Okay. So the first thing I'm going to do is just going to look you over. Okay. Everything looks good here. I don't see any nits, because you got to notice those. Don't see any lacerations in her head. Hair looks good. She's got good distribution. It's nice and soft and well hydrated. Skin looks good. Don't see any scabs, any scratches, any dry skin, anything like that. All right. Just going to touch you. Just tell me if you're tender anywhere. Tenderness? Nope. Tender here. These are her preauricles. These are her auricles, occipitals. Any pain here? Segmentals. I don't feel anything lumpy in her lymph nodes. Anterior cervicals, posterior cervicals, clavicular nodes, everything feels good. All right, you guys good so far?
Mm-hmm.
All right. Why don't you squeeze your teeth together, clench your teeth, move your jaw up and down. Any clicking, I don't feel any crepitus in her TMJ. Will you close your eyes for me? Squinch them up. Good. Good. Everything feels good there. Blow your cheeks out. Smile. Very good. All the facial cranial nerves, and I don't know what they are. You guys should know what they are. Intact. That would be, I don't know.
5.
Don't get nervous.
Good job, girls. Good job.
Yeah.
Okay. So that covered all of her facial cranial nerves right there, other than the trigeminal. So I'm going to go ahead and do those now. Close your eyes and tell me when you feel me. Okay. Tell me when it feels sharp or dull, okay?
Sharp. Dull. Sharp. Dull.
Good. All right. Now, next thing I'm going to do is check your eyes. If you'll come with me, we're going to go over here and read this chart.
Should I get my glasses?
If you wear them, yes. Do you wear glasses?
Yes.
Do you wear them all the time?
For seeing far away, I do.
Okay, go ahead and get them.
I'll just do it.
You guys post this on YouTube. We won't.
Here, I'll do your eyes for you so you know what I'm doing. Okay, so read the lowest line.
Cover one eye. Read the lowest line that you can read comfortably.
D-E-F-P-O-T-E-C.
Okay, then uncover. Do the other one.
D-E-F-P-O-T-C.
Okay,
Or
so
C.
it's okay. So with your corrected vision, your 20/20 in your left and your right eye. Okay. And now, next thing I'm going to do is I'm just going to look in your eyes. Okay. Well, before we do that, why don't you follow me? Okay. I'm going to bring my finger in. You just follow me with your eyes. Good. And then cover one eye. And I'm going to do this the way your book tells you to do it. And I'm going to cover my eye. Oh, this eye. And then I want you to tell me when you see my fingers. Look straight ahead.
Okay.
Okay, do the other way. Cover the other eye. Tell me when you see my fingers. Oops, wrong one.
Okay.
Okay, now follow my finger. I see no nystagmus. All of our eye movements are intact. Corneal light reflex. Look straight at my light. And I should see the light in both her corneas in the same place, and I do. Okay. And I'm going to look in your eyes here. And what I want you to do is look straight ahead, okay? Looking for our pupils. They're reactive on both sides. Straight ahead. Now I'm going to look in your eyes. Okay, you just look straight ahead, okay? Now I see the light reflex. Open your eye real wide, Ashley. Here we go. As I go in, I see your optic disc. I can see the vein in the artery and the macula. Okay, same thing on this side. Look straight ahead. Okay?
Mm-hmm.
Keep your eyes as wide open as you can, okay? Same thing on this side. I see the optic disc. Got the light reflex. Go can see the artery and the vein. Vein is going to be bigger. And her macula. Sorry.
Okay.
You guys think of anything else we need to do?
Ears, right?
Yep, I haven't done that yet, but the eyes. Eyes covered?
Yeah.
Feel good about that? Okay. So next thing we're going to do is I've already looked at your ears. I'm just going to feel around your tongue. Things painful? Does that hurt?
Nope.
Anything painful there? Anything painful anywhere where I touch? Okay. Doesn't work.
Is it on?
Okay. Now, remember to either turn your thing to the side or upside down. Don't go in straight. You're not going to be able to see good and you're going to hurt your patient, okay? As you go in, kind of look at the external canal. Looks fine. It's a normal looking canal. There's no redness. Tympanic membrane is shiny. No redness. Anything over here? External canal looks good. I just see some normal wax. Same thing here. And Ashley has some scarring in her eardrum, which I'm guessing she probably had ear infection when she was a kid. Yeah. All right. Good? Head's done. You know what
Do
easy
you
that
do
was?
range of motion on the head too when you're there? Or
I
no,
usually
do it
wait
at
until I
the
get to the neck.
end and then do that. Okay.
So the next thing I'm going to do is the neck.
Do you have to do the nose and the nostrils?
Yeah, and I didn't do that. Thanks for reminding me. So that's what I got you guys for. So when you're looking at the nose, remember don't
And now,
touch the septum. Okay? So you're just going to do a visual exam. Everything looks symmetrical. Her nose is in alignment. Nostrils look good. Bend your head back a little bit, Ashley. You're going to pull up on her nostrils with your finger there. Just visualize. And then if you had the speculums, you could go all the way in, but just be really careful not to hit the septum. And look at the turbinates. Talk about them. You have an allergy nose. You have allergies, Ashley?
Not too bad usually.
Nasal opening is a little narrow, a little swollen. So you could ask her at that point, have you had a cold? Any nasal congestion? Stuff like that. Septum looked good. Okay, so now we're on to your neck. Well, let's do your mouth. Open your mouth for me. You have all your teeth. If I had gloves on, I'd stick my finger in there, but I'm not going to. You want to have her move her tongue up and down. Move your tongue side to side. This. Stick your tongue up in the top of your mouth. Look at the palate. Now, you need to put a glove on and stick in there and feel the gutters, is what I call them. The bottom of her mouth. Make sure you don't feel any lesions there or any lumps or anything. And then you just make a mention of her mucous membranes are moist. Everything is pink. There's no redness, tonsils are not swollen. Stick your, actually hers are. No, yours aren't. Neighbors are. Stick your tongue out for me, sweetie. Tonsils are good. Okay? Grade 1, normal tonsils. Neck, look straight ahead. Your neck is midline. You don't see any discrepancies there. Can you move your head to the side? And to the side. Can you bend your head way back? Bend your head forward. Can you turn it over your ear? This side and this side. Just got normal range of motion. Okay? Squeeze your, shrug your shoulders. Good. Now, I'm going to push against your face. You push back against me. While I'm doing this, I'm looking at her spinal accessories. Over here. Same thing over here. Spinal nerve number.
11.
It's intact. Very good. I've already checked her notes. I did that when I did her head. All right? So the next thing I want to do is look at your jugular vein. I'm going to have you lay down. And I'm going to look at her, have you turn your head to the side there. And I see that there's no elevation. I don't see the pulses. This way. No elevation there. And I don't see the pulses. Okay? So you're looking for jugular vein distension. All right, next thing with the neck. Let's see. Go ahead and set up again, Ashley. Thank you. And I'm going to feel her trachea. Let's get right down here where the groove is. I can feel it in between. It's nice and mobile. Thyroid feels nice and mobile. Can you swallow for me? There's no nodules. Thyroid's nice and smooth. Go around to the back and feel it from the back. Find the groove. And then you could give them a sip of water. I usually just have people swallow. Swallow for me again, actually. It should be mobile. It shouldn't feel huge or enlarged or lumpy. Okay? That's your neck. Let's see, there's nothing else. Oh, I need to listen to your carotids. We need to do that. So to listen to the carotids, you have the patient take a big deep breath and hold it. So take a breath and hold it, and listen with the bell. And hold it. Okay, let it go. You'll hear a pulse, but you shouldn't hear a bruit. Take a deep breath and hold it. And it's really interesting, if you let them exhale while you're still listening, you can kind of hear that air go out, and that's what a bruit would kind of sound like a little bit, like just a friction in there, okay? Now I'm going to go around to the back and start on the back for my thorax. I'm ready to start on her thorax now. We're going to assume that I've already looked at her breathe and everything looks normal when I was talking to her. To do the diameter, the AP diameter, okay, Ashley, take a big breath for me. My fingers should move out symmetrical, and they do. Do it again. Okay. Now I'm going to listen to you. Take a big deep breath here. 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 Then you're going to tell them what your lung sounds are that you hear. Okay, whatever they are. You can hear regular vesicular lung sounds, right?
Mm-hmm.
Okay. Then the next thing you're going to do is you're going to, you can go ahead now and palpate the spine if you want. I usually wait till the musculoskeletal system part to do that. But you can do tactile fremitus. And so, Ashley, if you will, say 99.
99.